Yeah. My,
All right. So, about tonight's success story is we will talk about some of our candidates who have passed recently from Kolkata, okay, and under the Edinburgh College, and among them, one of our my friend, my big brother, my mate, Dr. Sandipan Bhai. So, Dr. Sandipan Bhai, please share your the total journey of your MRCS. Okay, how did you start, and like how much time did you take for your preparation, and what are the materials you used? What did you do? Did you had any kind of workshop or not? Like you can just mention everything if you want. Okay, go ahead. The floor is yours now. Today is your day, and once again, congratulations for your MRCS OSCE exam. Okay, go ahead.
okay. Am I clear? My
Yes, you
is
are.
my voice is clear? Okay.
Yes, you are. Yes.
Uh, Thank you. First of all, I thank Almighty for giving me this opportunity to move forward. So I actually I don't know how to share my experience. Uh, I can just want to say I will tell about two person, one friend and one enemy. And first of all, I will tell everyone that who are going to appearing the exam. I just want to say one thing that you are just one step behind to pass because you are on the right path. You are on the right track. So you are just one step behind to pass. Uh, the friend about whom I am going to talk, he is our mentor, our favorite mentor, and I just want to share a experience. I called him uh, just 1 month back before exam. 1 month before exam, I called him at 12:30 a.m. And believe me, you will not find such a mentor. I can bet you, you will not find such a mentor. I called him at 12:30 a.m. after finishing the lecture class. I asked him, how can I revise all the syllabus? And you can't believe he discussed with the schedule that I can finish my revision. He discussed with me for another 1 hour, 12:30 to 1:30 a.m. Can you imagine a mentor after finishing the regular class, he is discussing with me for another 1 hour? I am really lucky. I feel lucky that I find a mentor like him. And actually, uh, I was what I should say. Just I need not to say anything. Just do what the Dr. Atik said. It is that's enough for preparation. Just do, just blindly follow himself. Just
Bye.
blindly follow him.
No, 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 no,
Yes,
no.
yes.
Just
Let me finish. Let me finish today. Yes, I will. I will definitely. I will. You deserve this. Uh, I will definitely ask all the candidates that do just what the Dr. Atik said. And myself, I have done what he said. Uh, and I will ask about. I will say about. As I was saying, I will say about an enemy. The enemy is your work, your workload. I think this is the only enemy about your preparation. The workload in the hospital, your private practice, and the workload in the your uh, family activities. These are everything. This workload is your enemy, and how you can overcome this enemy? That uh, to overcome this enemy, you must be follow the course, the IMG course. if you follow the IMG course, that you can easily overcome this enemy. Otherwise, you will lose the track. If you follow the IMG, if you regularly attend the mock, if you regularly attend the sessions, and if you follow the advice of Dr. Atik, it is you will certainly pass. And regarding the hands-on, I have done another hands-on, so I can compare easily. The hands-on was excellent. I at first I was to be very honest, I was really confused whether I should attend the hands-on or not. But after completing the hands-on, uh, I feel that there is a change in my attitude. The hands-on was a complete one, and I also want to thank my course mates. They were all excellent, and so we made a good journey. And after completing the hands-on, I felt that that I prepare my preparation very well. And during the exam, in the skill part, I feel no difficulty. It was like a fun, and I think that is due to just for the hands-on course. And regarding the knowledge section, uh, the anatomy, the path, and the critical care section, I can remember that before the exam, I just heard the lectures of Dr. Atik, and was surprised how beautiful the lectures, because I just I just here I was just hearing the lectures of anatomy, the lectures of critical care, the lectures of pathology, and I feel that well, my revision is complete. And how beautiful the lectures, I feel that during the revision. So I want to say the same word, same manner, that is, just do what the Dr. Atik says, and that will complete your preparation. And I think that was everything about my preparation.
Okay, so tell us how many days it took to prepare your exam.
Hello.
And yes, can you hear me?
Hello.
Yes, Dr. Sandipan bhai, I can hear you. Can you hear me properly? Is my voice
Hello.
clear for all of
Is my
you?
voice is clear?
Everyone can hear us? Yes, no, please.
Yes,
Yes, we can hear
audible.
you.
Yes, sir. Yes, sir.
All right, perfect. Dr.
Okay.
Sandipan bhai, can you hear us? Yes. So, Dr. Sandipan
Yes.
bhai, tell us, like, how many days did you take to prepare yourself, or any specific strategies you followed just before your exam to pass this exam?
Yeah. One thing I must say, that is actually due to the workload, I didn't follow. I didn't attend in every mock. As a mentor, you know that I was not very uh, regular in the mock session. But what I did, I maintain a diary. Suppose I can attend the Lowly mock, but I was note down in my diary that I didn't attend the Lowly mock. Then when I made my free time, I heard the recorded mock, and if the and thus myself when I was in very huge workload, I maintained that diary, that what I have missed, and in my free time I make up that portion. And I tried, that I was never away from your curriculum. I was trying myself always attached to the syllabus of IMG. What what things you have taught in the lectures, I always try to follow that path. If I didn't completed your syllabus, I wrote it down in my diary, and in my free time I completed that portion. And that's why I just want to say that if IMG, I didn't follow the IMG, I was totally, what should I say? I was totally lost my track. But due to IMG, I didn't lose my track. I was busy. There was a gap in my reading, in my study, but I never lose the track. I was always on the track just due to the course. So I am grateful to IMG, and definitely I am grateful to my mentor. And I don't know
Thank you, Dr. Sandipan bhai.
how can I can express my gratitude to Dr. Atik. He's an excellent one, and I am lucky to have a mentor like him.
Thank you so much, bhai.
Thank you.
Please, can you share what are the stations you had in your exam, or was there any new questions or any difficulties you faced?
Actually, no. Everything was in the course, but I feel some new things that I want to share. That in the arthroscopy, cancelled arthroscopy examination, cancelled arthroscopy communication, the actor said a new thing that was not in our notes. He asked that, well, I am waiting until the consultant come back. This question was not in our course, but he asked these things that, okay, let the consultant come back. I will wait until the consultant come back. So I managed the question instantly, and this was a new thing. And another new thing was in the history taking examination. History taking, the uh, patient was anxious after being elected for cholecystectomy. So that was the new question, and when I asked her how have been suffering, how long have you been suffering from breathlessness? She answered that I am suffering from breathlessness for 10 years, but in our note that was about 6 months. So that was a confusing one, and I also made my DD that suit with the 10 years that causes 10 years of breathlessness. I uh, uh, I mentioned about COPD. I mentioned about asthma. So this was the difference from our note, and all other stations were very nice and according to our course, and I felt no difficulty.
All right. So, anyone has any questions to Dr. Sandipan or anything you want to know, you can ask. No problem.
Hello. Can I talk to Dr. Sandip?
Yeah.
Yeah. First of all, congratulations. Many congratulations to you.
Thank you.
I would love to know that was there any kind of like new questions from the stations, and what was your like stations, especially the knowledge part? Can you please share with us?
Yeah, actually, yeah. In knowledge question in PATH, there was a new question I faced that was a patient was having the skin graft, and there was an infection, and what investigation do you want to do? And I actually, as far I mentioned, and I mentioned all the investigations, but the examiner didn't take anyone. I think he was searching for a new one, but I don't know. I asked, I answered him that I will do gram staining, I will do culture, but he was not taking any answers. I don't know what will be the answer. But this was a new question I faced in PATH question. Otherwise, all the knowledge questions were according to our course.
Okay, so what was your knowledge stations? Could you please share with us?
Knowledge station. Actually, how do you want to know the stations?
Yeah, station names like from patho, from like ACC, and from like other anatomy? Just a little bit.
For ASCCC, that was the cervical spine injury, and for
Mhm.
there was hypothermia to the station,
Okay.
and in and in anatomy portion there was a thorax, uh, and I can't uh, I can't memorize them properly. I think Dr.
That's
Shubho
okay.
will help me.
That's okay. So you both were on the same day, right?
Yeah,
Yeah.
Shubho
Oh,
was
that's okay.
in the
That's okay then.
morning half, and
Okay. Oh. All right. All right. Thank you, Doc. Thank you.
Okay, anyone else wants to ask anything to Dr. Sandipan? Okay. So
actually, at last I will just say I will just share a memory. That was my one of my uh, uh, reading partner, Dr. Said. I don't know whether he is in the session or not. I practice with him about the communication. So Dr. Said is a very nice guy. He's younger than me, but he was a very nice guy, and I asked him one day during uh, conversation that the Said, how can I overcome the fear of exam? So he told me two things. That was that was very beautiful. Two things he said to me. That is that he said, when you enter the room, you will think that you are the boss of the room. And I always kept his word in my head that during the exam, don't feel so nervous. I'm the boss of the room. Don't be so what should I say? Don't be so shaky, so yeah, so much anxious. No need. Just think that you are the boss of the room. And this approach helped me in communication station, and also in the history taking and other station. I managed all the station smartly because I thought myself I am the boss of the room, and just for that reason, there was nervousness inside me, but I didn't show any nervousness. This is very important. And also, Dr. Atik said in the class, don't show your inner nervousness to the examiner. I kept the word in my head.
Your stress is your only enemy for
Yes,
your
yes.
exam.
This is the magic word that Dr. Atik said. Your stress is your enemy.
Yes,
This is
always
the
remember that.
exact word.
Let me share a short story about Dr. Sandipan Bhai. So the thing is, Dr. Sandipan Bhai, I was super tense. Like, what is his result? When I heard the result came out, so I called Dr. Sandipan Bhai, and I think he was sleeping. Okay, and he was like,
Yeah,
huh?
I
What?
have the
The
night duty.
result has been out. Okay, I don't know. Let me search. So I called him again after 5 minutes. And what he said to me is, I forgot my candidate ID number. Okay, just because of his stress. Okay, that's how much he is stressed about his exam and about his result even. Okay, and he couldn't find his result in the website and nowhere else. Right. So I called another one who gave the exam in the same college, Dr. Shubhovai, and I asked like, okay, how to check and all that stuff. And then I entered and I asked Dr. Sandipan Bhai again, okay, tell me your candidate number. So what he did is he used to do the practice with his son in his house, right? So he asked to his son, okay, what I was saying to you during the practice about my candidate number. So his son replied to him is your candidate number is 233. And I checked and I saw it's passed. And I said, "Bhai, you passed it, all right." So he was like completely lost. Okay, and he said, "Okay, I will call you back." Okay, and then done. So it was so sweet. Like the result has been given by me. It's something like very close to me because uh, most probably all of you don't know. Me and Dr. Sandipan Bhai started our journey together like last year, and we were in some different courses and all that stuff. I'm not going to say any names, but we started together, right? So now he is within the course. He passed this, and I said the result to him, and it's a beautiful thing for me. So, Dr. Sandipan Bhai, again, once again, congratulations and good luck for your future. And always remember this IMG family. If anyone needs any help, please help everyone. Okay, and don't forget us.
Uh,
Okay.
I am always grateful to this family, and I feel I am always a member of this family.
Yes. Yes.
And
Excuse me, sir.
Yes, Dr. Gupta.
Yeah, my question is to Dr. Sandipan Bhai.
Go ahead.
yes,
What was your last 10 day or 15 days strategies for
Strategy.
revision?
Yeah.
very nice question. Thank you. And during the last 10 days, I didn't manage the, kind of uh, uh, any kind of from my job. I didn't manage any leave, so that was very hard time. Uh, Actually, for revision of anatomy, I completely depends on the lectures of Dr. Atik. I heard the lectures, heard them twice or thrice, and for critical care and path portion, I took the revision with my hard copy, and uh, and uh, one thing I did in anatomy, that is, I used the recorded mocks. I just heard the question and then pause and then answer myself. Then again I started and heard the question, paused and answer myself. And I
Yes,
also
yes.
thus I practiced with, and that helped me a lot because after practicing in this way, I mm, uh, that was I was very fluent in anatomy.
Okay, sir. And how did you practice your examination and all skill part?
Yes, I am grateful to my son who is 8 years old, and please pray for him. He helped me a lot, and
Okay.
I practice over him. I practice over
Mhm.
him repeatedly, and
How
you
many how
can't
many
believe
times
that.
how
Uh,
many times you practice? Yes, yes.
and
It,
first, actually, I can share my strategy. First, after
Mhm.
completion the course, I mean that IMG hands-on course,
Mhm.
I dedicated 2 days for examination only.
Okay.
And in the during the 2 days after completion the uh, examination for 2 days. In the 2 days, just I just do the examinations, and I take in my mind what points should I do during the examinations. And after then, I was reading in my knowledge portion, and every day I was doing 2 examinations and 2 communication stations.
Okay.
But
And
first, you take your mind that you will do these points during these exams. Suppose you are you are doing asked to say, you are asked to do the varicose vein. So you
Mhm.
have to
Exactly.
must keep your mind that you will do these points. You will
Exactly.
do this. If you don't have in this mind, in your mind, you will not able to do that.
Exactly. Yes, yes, yes.
First, in 2 days, I did this. I took in my mind that in this examination, in CVS examination, I will do these 10 points. In respiratory examination, I will do this point. In the I just managed everything in the 2 days, and then I started the knowledge portion, and every day I practice 2 or 3 exams and
Okay.
2 or 3 communication.
So it means before the hands-on course, did you practice before also, or just after finishing the hands-on course, you started practicing the examination part?
Actually, to be very honest, I I just theoretically I just arrange the points
Yes, yes, yes,
on every exam.
yes,
I note down the points.
yes,
That
yes.
suppose CBS, I have to check that these 10 points. For varicose vein, I have to check these 10 points. I kept
Yes.
in mind that points, and in during the course, I was practicing that points.
Okay, got it. And what about history part and communication part? How did you practice?
Yeah, as just I said, I was a partner, and I also practice with him about 2 sessions per day, and it will take about 1 month to finish all the stations. I
Okay,
practiced him 2 stations, yes, 2 stations per day.
okay, nice. Thank you, sir.
Welcome.
All right. Anyone else wants to ask anything to Dr. Sandipan Bhai?
I would like to ask something.
Go ahead.
If you,
Thank you.
doctor, did you get any kind of like new picture from anatomy stations?
Everything is
Yeah.
a new picture.
Everything,
Yeah.
everything is new picture.
Everything was new, but but I
You
want to know this like it was
first
like
just keep
recognizable or something like that.
yes, definitely they are recognizable, but you should not answer in a rush. Take a deep breath, have a look to the picture, and then answer, because uh, your first answer will be taken. Mind that.
Okay,
Always,
got it. Thank you.
suppose I was about to, I was in one station during a course of internal cavity artery. I was uh, oh no, sorry, that was a branch of arch of aorta. The picture was taken from the front, and that was so clumsy. That was I should not say clumsy. That was a new one. Just like that, that was that picture was taken a different angle. That I didn't even recognize the branches of arch of aorta. So I made a mistake regarding the branch. Then I instantly I correct that, but the examiner said, "Do not please do not do this mistake again. I will take the first answer." So
Okay, got it.
be careful, but be careful before answering. They will take the first answer.
All right. Thank you, doc. Thank you.
Welcome.
As I said always, in knowledge, skip instantly. In skill, don't stop. Okay? To win short. I'm not going for the details. All right. Yeah, Dr. Mustafa, if you want to ask anything.
Yes, I have something. Sandipan, how did you manage the timing during the exam, and how did you keep yourself calm? You have any until you finish it?
Do you want to know about the timing during the exam?
No. How did you manage your timing during the exam, and how did you manage? How did you keep yourself calm during the exam? Yeah.
During exam preparation or exam hall? I didn't got
Exam
that.
hall. Exam hall.
Yeah. Exam hall. If you are fluent, I should say into knowledge part and the skill part. If you are if your preparation is well, that the question, they organize the question in such a way, I think, that time is not a factor at all in the knowledge question. So if your preparation is well, if your questions are then you will feel that the questions are very common, and you will definitely you will finish it in time. And regarding the skill portion, that is you have to I think you have to be a little bit faster, and they will they will definitely maintain the 6 minute and 3 minute. Suppose you have to ask for catheterization, you have no chance to do it very slowly. You have to do it a little faster, because there are so many things to do, and 6 minutes will be run very fast. So during the skill portion, you have to be a little bit faster, I think. But knowledge portion, time is not a problem at all, I think.
Okay, thank you so much.
Welcome.
Anyone else want to ask anything to Dr. Sandipan?
One thing I want to say, that is during the exam, I feel that, and I want to share that. That is, examiner may be casual. His style of asking question may be casual, but you will be always formal. Don't don't be casual during your exam. Always you will be formal. Like that, my examiner during the not tying station was very casual. Oh, please do that. Oh, how which teacher will use? But he was very casual, but I was very formal. I was formal.
Yes, that's called the professionalism.
Yes, I was formal from the end, from the starting, from the and the end.
Yeah,
And
you
also
have
in
to
the
be
catheterization.
so professional.
Yes, and in the catheterization station, I was the examiner was very, I think, a little bit casual. What will you do? But I was very formal. Sir, I want to document the procedure. I want to measure that. I want to everything that I was learned. I was said to him boldly and smartly, because I was so professional. You have to show your professionalism. But whether the examiner may be casual, but you never lost your professionalism. You will be formal always.
All right. Anyone else want to ask anything?
Yes.
Dr. Chris. go ahead.
Congratulations, Dr. Sandipan bhai.
Thank you. Thank you.
It's really grateful that our whole course candidate did really great. Like I was thinking about this history taking session. Were you able to complete the all the questions and family history, medical history, surgical history, everything? Was the time enough? 6 minutes.
Yeah. Then I can share you my trick.
Yes, sir, please.
My personal trick. Actually, the 10-step approach of Dr. Atik, that is great. I follow that. But my special tricks was that I made notes during history taking. It is very difficult to take notes without losing contact with the patient. But if you can take the notes, that is very helpful during presentation of the case. I made some small signs for onset, for duration, for timing, for exacerbation, for relieving factor. I made some small signs, and I didn't lose the contact with eye contact with the patient, and I took the note. Suppose onset, for onset I make a small sign. Onset, and if you want to write the onset and then take then write 6 months, it will take a great time. Just I make a small sign for onset, and in front of that I write down 6 months. I make a small sign for duration, and I know I write down suppose 12 months like this, and I practice it so many times that I can easily talk with the patient with losing any eye contact and taking the notes. And during the exam, I find that my examiners was very happy, and one of my examiner took me the sheet from me, and I when I exit the station, I found that she was looking in my notes very carefully. That
And
made
she
me
was very
so happy.
confused. What
No,
what
no,
this
no, no.
candidate has been
And
written?
actually she was
Yeah.
very happy, I think, because she was looking the notes very carefully. That
Yeah, because
yeah,
she wasn't able to decode your code, right? You are the only person
no,
who
no, no.
will understand.
Yeah, actually, suppose the onset duration. This was coding, but in front that the 6 months observation by and the
Right,
duration.
right.
This also
That's a
in Word.
very smart approach. Very nice.
And but one thing is that uh, you should not lose your eye contact during with the patient. If you lose
Correct,
the eye contact, you will lose your professionalism.
correct, correct.
And that was I took the benefit of this, because during the presentation I presented my case very nicely, and I didn't lose any point, because as I took the notes, so I mentioned all the point that the patient said.
Very nice. Very nice. Thank you, Dr. Sandipan Bhai, for sharing lots of things with us. And congratulations once again. Good luck for your future. Okay.
Thank you.
Thank you so much for being with us.